We go now to a Channel 3 exclusive. When the pandemic started, Rockville General Hospital put a pause on surgeries and other services to make space for COVID patients. Those services have not yet started back up, and nurses' unions are worried the changes could become permanent. Those nurses talked exclusively with Channel 3 Eyewitness News reporter Mike Savino. He's live now from that hospital with more. Mike, what does the company say about all this?
Well, Irene, the Eastern Connecticut Healthcare Network has applied for an application to make Rockville Hospital here a satellite to its sister Manchester Memorial Hospital. But ECHN says that's really just about trying to create some efficiencies with administrative functions and to cut costs. But the nurses are worried that this will also allow them to move some of those closed units to Manchester permanently.
We're begging for them to reopen over here, and we're not getting any response.
Eastern Connecticut Health Network closed 4 units at Rockville General Hospital in March to clear up 21 beds for potential coronavirus patients. But so far, that space has never been used, and nurses at Sister Manchester Memorial Hospital say they're overwhelmed.
We are definitely seeing a COVID surge at Manchester right now, and it's all hands on deck.
But ECHN says Manchester hasn't yet reached capacity. It also transferred staff to help.
You need to balance the needs of the community with your available staff, your available providers, and your equipment.
But there's another reason that nurses are worried. ECHN only got temporary approval for this move under Governor Ned Lamont's emergency powers. But in October, ECHN parent company Prospect Medical Holdings filed to formally merge the 2 hospitals into one. ECHN says its intent is to consolidate administrative functions.
It allows patients to have 1 medical record instead of 2. And it allows us to get out of a couple of duplicate fees that we're currently paying.
But it would also make Rockville Hospital a satellite to the larger Manchester Hospital. In its application to the state's Office of Healthcare Strategies, ECHN talks about expensive upkeep. RGH is a small rural hospital that, due to the nature of its separate licensure, must meet the requirements of a full-scale, separately licensed general hospital. ECHN also says consolidating would allow for optimal use of hospital beds across campuses during peak periods.
This area is it's always struggled socially, economically, so they rely on us.
The nurses union says patients who struggle to find transportation will be hurt if services are moved out of Rockville. ECHN maintains that's not their intent, but wouldn't commit to reopening the closed units.
As I said before, we will meet the needs of the community and plan to continue to do that going forward.
Now, in the first step of the approval process, the Office of Healthcare Strategy has asked ECHN and Prospect for additional information. The due date for that is January 18th. Live from Rockville, Mike Savino, Channel 3 Eyewitness News.